Okay, I think we can start now. Assalamu alaikum jami'an. Good afternoon, everyone. So, as you know, our meeting today is about the Central Hub KPIs project pilot, which will be presented and led by Shahalil from Central Hub. So, please feel free to write your questions in the chat or raise your hand. Shahalil, would you like to start?
السلام عليكم ورحمة الله وبركاته. Welcome everyone. طبعا the Central Hub is happy to share with you our experience in KPIs project pilot. So today my colleague Anis Chagar will go with you through this presentation, and please share with us any question for you. We are happy to answer you here. Go ahead, Anis. Welcome.
Thank you, Shahalil. Salam, everybody. I'm Anish Agar, manager with Kearney, and I've been working with Shahalil and the whole team on this KPI pilot over the last month, and we're here to present some of the work that we have been able to achieve in this pilot. So in today's agenda, we'll take a brief look at the introduction. We will have a small introduction explaining how this pilot started and why we are doing this before developing in detail the approach we took and the outcome we had, so we can share some of the knowledge we gathered throughout this exercise. So let's start with the introduction first. And as you know, all the model of care initiatives, they need to follow these 5 different stages to be fully implemented and successful, starting with the kickoff of the initiative, gathering the team, the system of care team, the initiative team. Then there is a long phase of the design of the pathways that you all know, using the pathway design manual developed by the COE, and including in this pathway, there is some KPIs that need to be defined there. Then initiatives turn into the preparation of the implementation before implementing really the initiatives. And finally, the last step is what we call evaluate and adjust the design. And in this phase, having KPI designed and being able to evaluate the outcome of the initiative is very crucial for the SOC leads and the initiative champions, because this will help them understand what is the progress of their initiatives really on the ground and how can they improve the outcome of their initiatives. So as I was just mentioning, the COE already developed a pathway design manual very clear for all the clusters to follow, with clear guidelines on what are the deliverables that need to be in there in order to be successful in these initiatives. And one of the deliverable is this KPI, these key performance indicators that are specific to every initiative. And more for the central hub and the central clusters, we see that there is now a bigger need to report on the outcome of the work that they have been doing, especially that now the central clusters are even more mature. C1 and C2 started working on the model of care since 2018, mid 2018. They were followed by C3, and now we have C4 joining the central team also. So they have been working for quite some time on implementing the model of care with some success there on the ground, but they always had some challenges. And these challenges, they were common to these 3 clusters around measuring the progress and the outcome of the initiatives they were working on. Some of the challenges we were able to identify is that the KPIs that were chosen across clusters were not always standardized. So if we take one initiative, UCC or ANC, every cluster will have a different set of KPIs that were not always standardized, which makes the comparison across cluster harder. The second challenge we've noticed is that these KPIs are not always tied to strategic objective of the initiative, which led to some cases where we have a big number of KPIs that were chosen for one single initiative. And these KPIs were not always tied, as I was saying, to the objectives, and that will just create a lot of work. Another thing we noticed is that some initiatives didn't have the full set of KPIs, and the full set of KPIs, the way we define it, is having structured process and outcome KPIs, the same way it is asked for in the COE pathway design manual. And finally, even when we had these KPIs, they were hardly implemented. The best case, we had some number of patients visits, this type of thing, but it was hard to really have updated KPIs for the structure and the process of the initiative itself. So these challenges will also impacting indirectly different stakeholders, because these KPIs are using in different ways, right? As I was mentioning, these KPIs are done for the initiatives, and they're used by the SOC leads to understand the progress and the outcome of their initiatives, and is their initiative successful or not. But these KPIs, some of them could also be used by the MOC team, the MOC lead at the cluster level, to monitor the cluster's overall performance in the model of care rollout and the performance of each SOC. And these KPIs could also be used one level up by the BU, by the Center of Excellence, to keep track of the cluster's overall progress and the success of the model of care journey, but also identify opportunities to support further the clusters. So these initiative KPIs, because they were not always tracked, led to indirectly to some challenges into being able to keep track and assess the overall progress of the clusters. And these KPIs are some of the KPIs used by the other teams. They could have also others. And this is where we focused our effort on. As a central hub, we focused on supporting the SOC teams in defining these KPIs and working on how they can report on these initiative KPIs. In order to do this, we divided our support across 3 main steps. The first one was about defining these KPIs. If you remember some of the challenges, they were around how do we have the right KPIs for these initiatives. So the first focus is defining KPIs. Once we define these KPIs, the idea is also how do we report and collect these KPIs? How do we really implement these KPIs? Before turning into phase 3, which is running this PDCA cycles and quality improvement and building this culture quality within the clusters. And this work was done mainly by the clusters, and the hub was acting as facilitators to get these KPIs defined and work on data collection and reporting mechanism. So in today's focus, we'll focus on the first phase, explaining how we were able to define a uniform set of initiative KPIs for 3 initiatives that were prioritized, which are UCC, RCC, and ANC. In phase 1, central clusters and us, the World Central Hub, we worked hand in hand and followed this approach to come up with this standardized and defined set of KPIs for these 3 initiatives. And we'll go you will go further in each one of these steps today, so we can all understand how we decided to go after this task and what was the outcome that we were able to have out of this exercise. Briefly here, just so you're able to follow on what's coming next. We started with assessing the current state of the cluster. I think it is very important to assess every time we do this type of initiatives, assess what is already existing, because we don't want to create something from scratch or dismiss some work that was done previously. That's what these assessments are done for. Before turning towards the standardization of these KPIs and the work in defining these KPIs and choosing these KPIs from the clusters were the ones designing these KPIs and choosing them, before finally, in the last step, detailing these KPIs with detailed definition sheets that will be used in the clusters. So in order to do this, we had various meetings and in various formats to engage all the clusters stakeholders, including some cross-cluster sittings where they were able to discuss across clusters and share their challenges and their ideas. Briefly on the format, we had to begin within the assessment cross-cluster group calls when we talked with the PMs and the team. We also had 2 workshops, both cross-clusters, before having the final validation session with each different cluster separately. And you have here, just so you realize a bit the extent of the work that was achieved by the team here. A lot of these sessions needed time to be conducted, but also to be prepared, and we'll show with you today the preparation work that is required for these sessions. And for our workshops, which is, I think, the core of the work that we were doing, because that's where the KPIs were coming from, we had some design principles to guide the workshop outcomes. We want to go somewhere. So we were guiding the clusters in order to get the KPIs that we can use. And these design principles were the following. One, we wanted all the KPIs to link to the initiative's objectives. Remember, one of the challenge was that some of the KPIs were not really relevant for this initiative. So we wanted all the KPIs, make sure that they're all linked to the strategic objectives of this initiative. We want them to be what we call comprehensive, complete, have the structure, process, and outcome KPIs, because this will give us enough information for the whole initiative, not just of the outcome, but also the status. We also wanted to have focused KPIs, avoid creating a multiple number of KPIs, but what is the bare minimum that can give me the full transparency and the full information I need to lead my initiative successful as an SOC lead. We also want these KPIs to be relevant. So I think you're familiar with this framework of having these smart KPIs. And finally, we want these KPIs to be KPIs that we can implement. The work we are doing is feasible. And this is also important. The outcome of this work is that today for ANC, UCC, and RCC, we were able to define these KPIs and agree with all the clusters. We have 10 KPIs for the ANC, 8 for the UCC, and 8 for the RCC, and we have detailed definition sheets for each one of these KPIs. So let's look now in the detail of this approach. What was the work that was done to prepare these workshops and these meetings, and what was the outcome of it? We'll go through the 1, 2, 3, 4 here on the slides with the cross-cluster group calls first, the workshop 1 and workshop 2, before talking about the validation calls. First, I mentioned previously the importance of the assessment. We organized a cluster-wide group calls to better understand the current work led by the clusters on KPIs. We wanted to know where are they today when it comes to the KPIs. So we had initiative leads, we had the PMs, we had the quality managers when they were some available from all the different clusters. And we walked them through, we had a different call for every initiative. And we asked them, okay, what are the KPIs that you already have today? What is the current status of the KPI collection? How does your cluster collect KPI today? What are you able to report on? What are the challenges that you're having? And who are the people that can talk to who are experts in data in your clusters? And these were the outcome of these assessments, because this was feeding immediately our workshops, because we can identify how to better facilitate the workshops, but also how to make sure that we invite all the right people in these workshops. And these workshops, in terms of preparation, included also aggregating all the existing KPIs for the model of care initiatives that we were working on. And the sources were very multiple sources. We also then developed scoring criteria, because now that we will aggregate all these KPIs, we were thinking about how are we gonna prioritize these KPIs to pick the right ones that we need. And finally, we also scored this long list of KPIs to introduce them to the SOC teams, to do some of the free work for them and help them and facilitate this discussion before going into the workshop. So in preparation of this workshop, we aggregated all the KPIs from multiple sources. We had all the cluster existing KPIs from C1, C2, C3, but also other clusters. We took any COE design standards that were done at that time. We also looked at international benchmarks for these initiatives and had some interviews with some experts on this. This led to an aggregated list of KPIs that here, for example, as a UCC, we had more like around 20 KPIs, different KPIs for the UCC that we then had to prioritize. For other initiatives like the ANC, we had over 200 KPIs, just so you understand a bit the scale of the number of KPIs we had. And when we had 200 KPIs, we had to prioritize them also in another way, identify some themes. What are the common themes? Because these 200 KPIs were sometimes referring to the same theme. Once this aggregation work was done, we were thinking, how are we going to prioritize this? So we defined the 5 most characteristics of strong KPIs and used these characteristics as a prioritization criteria for the KPIs we aggregated. These prioritization criteria are the following. We wanted to make sure they are relevant, it's feasible, actionable, acceptable, and timely, which is a well-known, I think, framework for KPI selection. And I think some of the I think the feedback that here we received from the teams that we worked with, having something actionable was not always the case on the KPIs they had. I think they really liked the fact that when we looked at this KPI, you as SOC team, what is the action you can take out of it? You need to be able to take an action with this KPI. You need to be to understand it, and it needs to be also, it needs to be feasible. With this work of aggregation and prioritization of the KPIs using the prioritization criteria, we went into the workshop. First, in the workshop, the first thing we did was agreeing on a unified set of objectives for each initiative. We wanted to make sure that we all speak the same language, that A and C for us means the same thing. We all have an idea of what is a UCC, what is an ANC, what is an RCC, but what are the main objectives? Why do we even are we even doing these initiatives today? What are the challenges that we are solving for? What is the focus today? What is the focus in the model of care? What is the challenges in your clusters? And these challenges were like common across all the 3 central clusters here. And by tying these objectives together, it made the definition of the KPIs easier, because we knew what we were trying to solve for and what we needed to look at to make sure that we are solving for what we want. And that was the goal of having these objectives. And you can see here an example for the UCC. We took as an input here the series manual for the UCC, the cluster-specific rollout plans, and also international benchmarks. And based on this, we were able to define the unique set of objectives, and I would even call them strategic objectives for the UCC. And here they go with the triple aim. With population health, we were looking at increasing timely treatment for critical ER patients, having a standardized service delivery, improve access to urgent care healthcare services, and optimize use of key resources. Once we define these objectives, we explained and practiced the scoring of KPIs through facilitated discussion during the workshop. This is all the KPIs we aggregated from the different sources that I listed before. This is the framework to score and prioritize these KPIs. Is it clear? Do you have any questions? I think everybody there was pretty happy with this methodology. And we started with some examples on how we can prioritize these KPIs. I think that was a great session there, because it gave us a clear baseline for everybody in the room about these KPIs and how we work with it. We were not able to go through all these KPIs, obviously, on these meetings. This workshop is around 2 hours for every initiative. So to have a further validation of these indicators, we have given this Excel as a homework to the clusters themselves. Okay, now you're clear on the methodology. Could you please review these KPIs and score them using this framework, and write down any comment you have? Because at the end, this is a facilitation exercise, but you are defining the KPIs. And they shared with us the Excel and any comments they had. And we use this as an input for our second workshop. So for our second workshop, the preparation work we did was aggregating the scores, ranking these KPIs based on the scores, and identifying convergence and divergence points among clusters. So we can start the second workshop. Following the first workshop, the clusters, they validated the KPI scores, and this is the work we did as a preparation for the second workshop. We took the results from C1, C2, C3, aggregated them, and ranked the KPIs, and took the top ranked KPIs. We were also able to map the top ranked and prioritized KPIs. They were linked to the initiatives. Remember the objectives of this initiative. We want to link them. We want to make sure that every one of these KPI that we choose is achieving something for our objective. Because this is why we're doing UCC. This is why we're doing RCC. These KPIs are not here to create medical records. We are really here to measure, are we achieving our objective? So we tied these KPIs to each objective, but also, again, we looked at our framework, structure, process, outcome. Are we covering the whole chain? Structure, process, and outcome, making sure that we understand. And I think it's even more crucial when we are at the beginning of these initiatives, because the structural KPIs, they can give us a picture of the status at the beginning of this initiative. That's why it's important not to focus only on the outcome ones. The outcome KPIs will take longer to have any significant results. Second check we did, finally, was to make sure that this is aligned with the design principles. And we conducted this with the participants in this workshop, making sure that these KPIs were the right ones, that they met our, they are tied to the objectives. We have enough structure, process, and outcome KPIs, and they are all aligned with the guidelines that were defined in the first workshop. With this, in this second workshop, we finally had a set of KPIs, because we also took into account like comments that the teams had and everything. And we were able to have for every QCC, RCC, and ANC a unified set of KPIs. We took these KPIs and we defined them. We had detailed definition sheets, and we identified inputs areas for the clusters that we needed for missions, and we had validation sessions with them in this last step. So the outcome was obviously these different KPIs, 10, 8, 8 for ANC, UCC, and RCC, but also not just the KPI itself, so the detailed KPI definition sheets. These KPI definition sheets were defined across specific dimensions. And we also created, I think that was very something that the team really liked, created some mock dashboards to gather feedbacks from the end users, because remember, the end users are the SOC teams, right? So I think by looking at these KPIs in a more visual way, they understood what we were trying to do here. And I think we had a better feedback this way than when we were just talking about like the name of the KPI itself, because once they were able to visualize it, they understood, okay, so me as a SOC lead, I will be having a look at this dashboard once a month. And from this dashboard, this is the action I can take. This is what I can spot. These are the issues that I can see. Here on the left side, you can see some of the dimensions we use to define the KPIs. This is, by the way, very like wide used across the globe for every quality process. And actually, I think some of the clusters, C2, for example, had already a template that needs to be filled for any KPI that needs to be reported on in the cluster. And these are the same the fields that are needed. So obviously the name of the KPI, the definition of it, why are we using it, the rationale, what's on the numerator, on the denominator of this KPI, but also what are the exclusion and inclusion criteria, how are we calculating it, in which setting, what are the data requirements, when are we measuring this, like the frequency, the methodology, who is doing it, the source, and the target. Now that we have defined in detail this KPI, the next steps are focusing now on the data collection and reporting mechanism. We have a clear set of KPIs that were validated by all the teams across clusters. And now the goal is, okay, now that we have defined in detail these KPIs, how are we going to collect it and report it? And this is the current focus that the team is working on. And the approach we have taken is a bit similar in some way, is this four-step approach where we want to build, and the important word here is sustainable. We want to build a sustainable collection mechanism specific to each cluster. We understand that every cluster is different, that they have different teams, different ways of working, and we want to build something sustainable. We don't want to just report on these KPIs for 2 weeks and then it goes out. That's why we decided to use this cluster after some brainstorming within the team. And this approach was basically drawing the KPI dashboards and list all the data requirements from the KPI definitions, because this will give us a better clarity on the data fields that we need. What do we really need in terms of data, right? Because the KPI, the clinicians were having, they supported us a lot on defining these KPIs, but when it comes to data, it is not the same people in the clusters that look at it. And that's why we had the assessment, and which is the phase we are completing now, we are assessing the current state of data collection and reporting in the clusters. How is the cluster today working to collect data across facilities, PHCs, and hospitals? And how are they reporting it? Some of the learnings that we are having now is that for some of the clusters, they have a centralized data team that is working on collecting and reporting these numbers. And they work with hospitals, and they usually, their office is within the biggest hospital in the cluster, but they also work with community health for anything that comes from the PHCs. And you know, the challenges there are very diverse with like having helm in the PHCs and different HIS across hospitals. So now we are working with these teams to understand how do they work today? Which data are they already collecting that we can use for the MOC initiative KPIs? And how we can work together, how the model of care team can work with this team, the data collection and data experts of the clusters, to build the sustainable data collection and reporting mechanism before we can start building our MVP. And this is, again, something very important. So MVP stands for minimum viable product. We don't want to come and say, oh, we want all these KPIs to be reported by the end of the month. We understand that there are like technical challenges, but we want to start building an MVP. What are minimum KPIs we can already report on with what is already existing today? That doesn't require any heavy lifting, any big changes. Data that you already have today, could you just like pass it to the model of care team? They're interested in having it. And we want to start building this MVP as soon as possible with the teams and develop these ways of working between the model of care and the data experts team before turning and looking at the long-term view and defining what could be the long-term view of this data collection and reporting mechanism, and do this within the cluster, from the cluster, and the central hub is acting as a facilitator to get the teams there to the point where they are able to work together. So thank you for listening. I hope that this gave you better understanding of the work that we were able to achieve. We will share with you the detailed workshop templates to work on this with this similar process for initiatives with the similar challenges. Thank you, everybody.
Thanks a lot for your presentation. I hope, team, that this is an informative session for you. If you have any question, please, or any comments, let us know. طبعا there's a comment بس I would like to share it with you that the KPIs, the list that we have, the final list that we get, including the Center of Excellence KPIs. So actually the 10 ANC and the 8 for RCC and the 8 for UCC, including the Center of Excellence KPIs. تفضل عبد.
A very good point, Shahalil, actually, that like the outcome, because some of the COE KPIs, when they were, because we looked at the also COE KPIs, and they had some that were for ANC, some that were for the UCC, for example, and these KPIs were captured within the initiative KPIs that we defined with them. So this could be escalated to levels above and be reported on. And the example, I think the team here is pretty familiar with these KPIs, was for ANC, was the number of ANC enrolled patients with 4 antenatal visits, and the UCC one, if I remember, where it was around like having decreased the number of low risk patients in the ED.
تفضل عبد الملك.
Go ahead, بدر رفع يده.
تفضل بدر.
Sorry, this is me actually, not Bedr, but I'm with them in the meeting. Thank you so much for this. I have a couple of questions. The first one is, are you seeking international benchmarks for the KPIs that you have? You know, are you accommodating for potential, you know, how are you driving the data analytics? Do you have like a plan of action? Like there are certain outcomes that you can see. What I'm trying to say is that you need to map them to the ADA KPIs, which are the performance indices that are monitored by the ministry. Have you done any of these mappings between the initiatives and how they can, by proxy, improve the performance indices in the in the ADA KPIs. Thanks.
Yes, hello. So to answer the first question around international benchmarks. So we looked at international benchmarks for these KPIs, and I think the teams themselves, when they define these KPIs, because if you remember, these KPIs were defined also in the pathways that were submitted. Themselves they did some pre-work there into looking at what is being reported elsewhere and what are the crucial KPIs that we should look at, but also looking at the reality of the country. Some of these KPIs, because the challenges are different, for example, the ANC visits, the target today in Saudi is having 4 ANC visits. In other countries, it's more, in other, it's less. So this is where looking at international benchmark was good there, but also adapting it to the reality of the cluster. One other KPI was around breastfeeding, because breastfeeding was a national priority. That was not the case in other countries. So that's the work that was done around international benchmarks. When it comes to data analytics and the ADA mapping, this is a very good question. Actually, we looked at some of the ADA KPIs that we had access to, and the ADA KPIs are based on our current understanding, more outcome focused, because they relate to the population health data. So some of these KPIs are captured within the outcome KPIs for the initiative, but ADA KPIs, they hardly capture information on structure KPIs and process KPIs. And to give you an idea of why this is important, if we take the example of the ANC, structural KPIs are KPIs like number of trained ANC nurses in the PHC, because we can say that we have enrolled 1,000 patients in this PHC, but if we didn't have an ANC nurse, we didn't have the ultrasound machine accessible for this PHC, what were the services that we really provided in this PHC? To be able to answer this question when the initiative is starting, we need to look at the structural elements. Do we have the structural elements in the PHC to deliver the services that we defined as part of ANC? This is why there are these structure and process KPIs that are more important for initiatives like this that starts, that are not today in the ADA KPI, because the ADA KPI are looking more on an outcome-based phase, and they will tie together to a certain point. That's my first part of the answer. The second part of the answer is that we are working with the data teams in the clusters. That goes to your question around data analytics. We are working with the data teams within the cluster to do this, because we want to avoid duplication, and we want to tie this work, like this data flow, to any other initiatives that are happening in the cluster as much as possible. So that's why anything that we do goes now through this data team within the cluster. So for example, I don't know, Doctora, which cluster you're from, but in C2, the team is the strategic and planning team. The team has been working with the cluster for multiple years, and they are working, they aggregate all the data requests that come from multiple resources. And the same for the C1, it's a new team that was created. It's called the Data Governance Department. And they work with FAP also to capture the ACO KPIs. They work with ADA, they work with public health, they work with all the stakeholders. So we are, by working with them, we make sure that KPIs, they get reviewed by this team, and we avoid duplication, and with any time we can use something existing from ADA, from anything else, it will be done. I hope I answered your question.
Thank you, Anis. إذا تسمحوا لي أحمد بن ناصر دكتورة. Yeah, so I just wanted to stress on one point. What is the motivator behind all of this? This is زي ما تقولوا, it's almost like a pilot project where it was initiated because we had a gap. The gap is when I want to get clarity on where the progress of each initiative across all clusters, the same initiatives across different clusters, it's very hard to know. When I get asked by my VP or by the Dr. Al-Saghir during the 7 a.m., have they implemented, how far are we with the model of care? The current KPIs, most of them are outcome KPIs. But we are at the beginning of the journey, and the beginning of the journey where things are being set up. We need those structure and process KPIs to actually have to validate and make sure that we're not just getting impressive numbers that are meaningless. Yeah, Anis mentioned the example of having ANC clinics, a number of enrolled patients, and it turns out that not the same single ultrasound machine was available in those PSCs. So that's one side. The other side is that having a common language when we're assessing, or a common shared assessment across different clusters when the hub wants to compare. It's not like different KPIs comparing apples to oranges. So when we're comparing one cluster to another, we can really tell how far each one is going along those pathways and those projects. Now, on the other side, there's always the negative part of adding more data collection, which is something that we need to avoid, and clusters are always complaining of the amount. And that was somewhat mitigated by involving the data for departments and accommodating all the existing center of excellence, whatever is available from ADA, whatever is available, we accommodate, we try to minimize the duplication or avoid any duplication, have only the essential required information that can give us the objectives and are truly to the objectives of those initiatives. So it would be really interesting to know if in the other hubs, if they have not faced such a problem, or if they did, how did they avoid it, and how did they avoid it or work around it? For us to share this knowledge. Thank you.
Thank you very much, Dr. Ahmed. Abdelmalik, do you have any question?
Yes, مرة يعطيكم العافية. Thank you so much, Shahalil and Anis. This is actually really great work, and I like how you link things together with the manual itself and everything. And I can see once we start to update the version 2 manual, we can have more of information and guided, let's say, steps for the team in the cluster to work on the KPIs. First thing, I just have a small comment. Please, let's always use the updated template for the holdco. I'm sorry for this. I have 3 questions. We don't have to answer it now, but it's definitely something we need to sit together and think about it together. The first one is, what is the difference between these KPIs and the KPIs are actually already listed in the pathway manual or the pathway design? So for example, if we have an ANC pathway already designed, there is a list of KPIs that was designed by the cluster itself, and then it went to the network for reviewing and so on. So are they actually the same? They're not the same. And if not, then we need to figure out how we can align all of these together. So this is the first question. The second thing is, how are we going to mitigate the burden of data collection? So now there is data that's already being collected to MOH. There is a data that's Holdco already asking the frontliners to collect, and there is a new batch of KPIs will be released as a clinical outcomes and clinical policies that we're looking also for the clusters to collect, in addition to the ones that related to the enhanced primary care. So there is a lot of KPIs already. We're asking for the clusters to collect. So this is one thing. The other thing for us, for the second question, that we have already aligned with the network and the MOH on their PHC KPIs, and the network have reviewed it, and we're sending them the final list with the model of care to try to streamline the data collection. So the cluster will not be confused by different entities calling them for KPIs. The third question I have is, how are we going to take this forward when it comes to the future design pathways? So for example, if there is a new pathway that we're not designing, asthma for example, how can we take this work and use it to overcome everything that we're facing now and to build on it for the future pathways that we're designing? You suggest, for example, sessions we do with networks, or certain exercises from your side as a hub to train to train the clusters while they're designing this, or maybe we need to change the approach of facilitating the KPI session during the pathway design process. these are the three questions. I know there are a lot, but and I'm not asking the Central Hub to answer it now, but maybe if we can have some time to discuss these questions, and I'm happy to sit again, myself and Hayat and the team to help you in these things, because I can see this work can be taken to a national level.
Thank you, Abdul Malik. I think these are all great questions, and I like what you were saying also on your last point around how can we rethink a bit our approach to the KPI design in the pathway manual, because so far this was done at the cluster level, and we know that there were some difficulties there for the clusters to define themselves internally the right set of KPIs and to take into account all of these challenges that we were mentioning. So some of these KPI, sorry, yes,
yes, I just want to add one thing, and also the designed pathways already. So the ones we have already now. So we have almost around more than 20 pathways already been designed. So how can we take this work and improve the KPI piece?
Yes. For the designed KPIs, actually, we started, like that was our input. The design KPIs, these KPIs was our input. And we asked for every pathway that was designed, we asked the team, are you able to report on these KPIs? What are the challenges that you have today? So what we noticed is that most of the time, the KPIs that were defined on the pathways, they were still not able to report on them today. They still had some challenges, and the challenges that you were mentioning also, there is the burden on like the frontline workers reporting these KPIs, or they didn't have the right relationships within the clusters with the data. And I don't think there was any cluster that was able to report on the KPIs they had in their document, in the pathway design manual. So we use this as a starting point, and we help them with basically asking them the question and prompting them and pushing again and again to get to the point where they feel comfortable about these KPIs, that they are helping them achieve their objectives, and that's something they can, as a team, start reporting on, and it's something feasible and give them clarity. So I think that's some of them of these KPIs where we worked, but we also, since we use them as an input, a starting point, that's the foundation of the work that we did with the team here. So for A and C, C3 already had a list, and C2 also. So and C1 they just submitted theirs. For A and C, we took these KPIs from them, all of them, and we said, okay, based on your experience, you have been working on this initiative for this month. Are you able to report on this? Do you think that this KPI is still valid? Not like, what's this challenge? And then themselves, they were like giving us a lot of very like interesting information, that lessons learned since they defined these KPIs. And when it comes to, I think, for next initiatives, by doing these workshops, at least with the PMs we had and the team, I think now they have a better sense of what is requested. Why do we need these KPIs? We don't just need these KPIs to put them and send them to the COE. We need these KPIs actually to understand our initiatives. And some of the clusters, like especially C1 and C2, who are more mature, they have been like rolling this initiative for a long time. There's some change on the ground, but they were just not able to report on it on a proper way. So by doing this exercise, I think the team now is understanding better what is the expectation. Why do we need this KPI? It's not just a check before sending the document to the COE. And this is, I think, where we can sit together and think about what's the best way to engage the clusters when they do this design committee and these design sessions around KPIs.
So actually, Abdul Malik, the workshops, I can count it as a training workshop and sessions for the PMs. It was really useful. I felt that they understand the initiative more, as Anis has mentioned, and understand the concept of the KPIs and how to report on this for future-wise.
Very good. I'm still happy to take this further, because I still think there is a lot of things to be done around that, and I don't want that we work different directions, because just one thing to keep in mind, that a lot of work at the level of let's say on a national level, especially with MOH, and specifically with the PHCs, that they're putting all of the efforts to align all of the KPIs, to streamline the data collection and all of these things. So let's look into what are the gaps in the system that we can take this kind of approach to fill in the gap. So for example, I like what Dr. Ahmed bin Nasser and you, Anis, mentioned around, do they actually, when we start to want to design, let's say, a pathway, do we actually go on ground, see what exactly the resources available? Do we have the people there? Do we have the equipment, have the medication? Do we have the access? And all of these elements that we identify. So for example, once we implement, 6 months later, I can show, is there like an impact of this pathway? Did this pathway worked well, didn't work well? There are areas that we need to improve. So if we link it to pathways, my suggestion, if we link it to pathways rather than specific services, because a pathway includes multiple services. So let's say within the manual itself, maybe this is an idea in version 2 manual that we can update next year, that, for example, within the pathway, we identify what are the services. For each service, for example, we have 1 to 2 KPIs that measure the value of this service. Is actually the service implemented in a PHC brings a lot of impact to the citizens or to the patients, or not really? And this, one of the things that we don't have an answer for now, for example, the one-stop clinic. Having, for example, x-rays, access, and so on and so on, is it actually good to have C, or it would be better other perspective to be in a hospital? All of these are still open questions, and if we don't have data to monitor this kind of services and the impact, then it's going to be useless. We're going to always say that, oh, we're doing well, but how are we doing well? We don't know. So I really want to sit with you guys and we discuss this further. Unfortunately, I have to leave for another meeting, but let's keep these as like an open questions, and let's do a second session around this.
Yeah, that would be great.
Sure, Abdul Malik. Anyway, احنا إن شاء الله we are planning to have other session on January when we will finish the second and third phase, so we can update you with the 2 other phases when we done with it. And regarding we can meet together إن شاء الله soon يعني to answer this question and to align together also on the next steps.
Maybe I wanted to share something, if you don't mind. It might be slightly off topic, but I think it's quite important. Looking at the KPIs is one thing, but also like making sure that, you know, people that are collecting data understand how important it is that they are honest and that the data is valid and complete, to be able to make an informed decision based on these KPIs on how to improve the pathways going forward. So we struggled a lot with E1 initially, in that there were areas where they were just not submitting enough data, or their data was incomplete, or they were delayed, or the numbers didn't make sense. So we started something, and I want to thank, to be honest, Reem Al-Qahtani and James from AT Kearney, that they've actually, Reem Al-Qahtani from E1 and James, that they've actually spearheaded this initiative. So we established something called the Quality Council. And the Quality Council is when you have the project, you know, whoever is collecting the data in the zones, in the front line, meet once regularly, periodically, once a month or every 6 weeks. And we kicked off that meeting, and I attended that, and we told them that they're probably the second most important people after the healthcare providers, because the healthcare providers provide care, but they're the ones whose numbers reflect whether, you know, we're doing a good job or not. And then we sat with them, all of them, and explained to them again, why are we collecting this data, and what does it mean if this data is going one way or another, and how important it is to be honest, because it's going to affect the provision of care in the region. And we've been doing this now for a year, and we can definitely see a trend in the positive manner, in that, you know, the numbers are, you know, it's easy to validate them, and, you know, 90% of the time it's accurate, and it's complete, and it's easy to collect. So, you know, further on to doing the KPIs, I think that's another second step that might need to be done going forward. So it was, yeah, I just wanted to share that experience. Thank you very much.
يعطيكم العافية دكتورة مريم، شكرا. I totally agree. لكن I think the problem that we're having is that if the one thing, and I would like to get your opinion about اللي هي during the setup phase, is it logical to have the same KPIs for something that is still in the setup phase, and maintain those same, which are usually outcome-based KPIs? In the first year.
The way that we look at it is, we say when we're piloting, we look at obviously outcomes, but we look more process. We look at, are we doing it the right way? And it's early days to look at after outcomes. And then with time, after the 3 months, definitely we start, like with diabetics, it's impossible to look at outcomes immediately. HbA1cs, will not change until 3 to 6 months later.
So how do you monitor during that first initial phase, if things are going along, if resources are available, if there are any support that they need, if there's any more further training? How do we actually objectively monitor that phase, that initial phase?
The initial phase is mainly monitoring of the process, and we always declare and disclose and say it's early days to say whether we're doing a very good job with regards to improving outcomes or doing a very bad job either. But we monitor it, but unless there is a massive red flag, we don't report them. And then we report outcomes every quarter. And that's how you see that there is a trend in the positive direction. But that's how we've done it. And then there are certain things where you see very quick improvements in outcomes, like urgent care centers. And it's not outcomes as in patients improving, but percentage of CTAS 4 and 5 reduction in the emergency rooms. That can be seen very quickly once you start, do very good marketing, open an urgent care center, triage away, shift patients out. You start seeing the numbers we've seen them after like about 6 weeks. But like with hypertension and chronic disease, la. You need much more than that.
Yeah, thank you.
Thank you.
Thank you, Dr. Mariam, for your comment. Any other comment, please? طبعا we asked the Center of Excellence Shahad to record this session, and it will be uploaded on the Basecamp. Inshallah, as I mentioned, we will have other session in January after we finish phase 2 and phase 3. And كمان حيكون إن شاء الله عندنا updates after إن شاء الله we finalize everything with عبد الملك and get his comments, and we hope this session was informative one for you. Please share with us your comments or any question you have later on. You can email me or me. I'm here questions or to you if you have any comment. Thank you very much.
Okay, so thank you so much, Central Hub team. Thank you, Anis. Thank you, Shahalil and Dr. Ahmed. يعطيكم العافية. That was really informative and insightful for all of us. As Shahalil mentioned, the recording will be uploaded to the Basecamp, so will be accessible and available for everyone. And thank you all for joining.
يعطيكم العافية. شكرا. مع السلامة.
السلامة.
Thank you.